Good evening, and thank you for joining us. I'm Kent Davis. This week, officials identified the Omicron variant in California, confirming that it's made its way to the U.S. We spoke to an expert about what this variant could mean for Michiganders. Dr. Jim Grant is the medical officer at Blue Cross Blue Shield of Michigan. He says variants develop over time as viruses stockpile mutations. Most of the Omicron variant's mutations involve its spike proteins, the part which lets it invade our cells. He says some mutations resemble those in the highly contagious Delta variant, but that doesn't necessarily mean it's deadlier.
What they've seen in South Africa with Omicron is it spreads much easier, but the initial reports are you're not as sick, especially with a heavily vaccinated population.
However, Dr. Grant emphasizes we still have more to learn, and the best course of action is to exercise caution. In the meantime, he says vaccination is key, especially for Michigan, which had the highest number of COVID cases nationally in November. In the event of a breakthrough case, Grant says immunized patients still have better outcomes.
If you look at our patients that are succumbing to the disease, for the most part, over 85–90% of the time, there are unvaccinated patients. So what would have happened if you had a friend who got the vaccine and still got sick? He or she, if they didn't have the vaccine, would have been so much sicker, just so much sicker. Who knows if they would have survived COVID?
Dr. Grant also says getting immunized means the virus has a lower chance of using our cells to reproduce. If they can't reproduce, they can't mutate. And fewer mutations means lower odds of trouble for the rest of us down the line.